It's been nearly 2 weeks since all Idahoans became eligible to get the COVID vaccine. And earlier this week, Idaho Department of Health and Welfare set a goal of getting an 80% vaccination rate for all Idahoans by September. That would mean 1.4 million would need to get a COVID shot. And so far, just about 380,000 have been fully vaccinated. But how does that break down by age? Well, that dark green line there that you see shows the number of people who have gotten both doses. The light green line, only one dose. As of today, you can see Idahoans over the age of 65, well, they're well on their way to being fully vaccinated. Most have been eligible since the beginning of the year, so they've had a little extra time. But as you can see, younger Idahoans, they're taking their time before getting the shot, apparently. Which leads us to this question. How many of the younger generation are actually wanting it? Katya Stepovic checked in with some healthcare providers in the Valley this week. Some say it's a little too soon to gauge just how high of a demand they're getting from the younger age groups, while others say they are pleasantly surprised by the turnout so far.
Sadly, the demand for the vaccine across the state, across the population, appears to be plateauing. It's not that immediate rush of the elderly.
Dr. Stephen Nemerson, Chief Medical Officer at St. Alphonsus, says it's a little too soon to tell if the plateau is due to a lack of interest in the vaccine from younger age groups.
We have sufficient capacity to be able to accommodate the complete demand.
But now that the state is finally getting more supply, Nemerson says it's crucial for younger Idahoans to get the shot.
It's the high schoolers and the college age people that spread this virus more commonly. In part, it's probably because they can have more virus in their bodies and not get as sick. So they're out and about with it.
Nemerson worries that the increase in patients hospitalized with COVID is the beginning of a new surge due to mutant strains.
Even a young and healthy person could be one of the rare unlucky ones to have powerful side effects and complications from this disease. And God knows that none of us want our child to be that one in 10,000.
Meanwhile, Shayla Wooster, a nursing student at BSU, says she's pleasantly surprised with her generation.
Out of my friend group, everybody I know has been vaccinated or is in the process of being vaccinated. And I think most people are excited about it.
Wooster is also a vaccinator at a primary health clinic. And in the last week,
lately, there's been a lot of that age group being vaccinated, a lot of people coming in with their parents. I'm a little surprised to see as many people 18 and younger. But I feel like people in my age group, 20s, are excited because they want to congregate and stuff like that and get rid of the masks.
Wooster admits that she too had a moment of hesitancy before getting vaccinated, but ultimately the pros outweighed the cons.
A couple of my friends also decided to get vaccinated based on me working for primary health and, having more information, which is really cool. They decided, what, it's worth it. Let's just do it. Even if it's scary, even if there's unknowns. Think about your future. If you want to, see the people you care about, your grandparents, your parents, people who who might be at a higher risk. Do it for them if you don't want to do it for yourself.
Nemerson says he hopes this generation knows they have a lot of power to crush a potential fourth surge.
I want to get back to normal. I am so tired of this virus and what we have to do to protect ourselves and the people that we care about. This virus can be eradicated if we immunize everybody. But if we don't vaccinate everyone with a COVID vaccine and a significant amount of people in Idaho don't have it, then the virus is going to continue to spread, and then it's going to continue to mutate, and then we're going to have many more problems on our hands.